I am Dr. Singh, Surgery Professor, Usmania Hospital, Hyderabad. We are using this CIRCUMSURE, which is a very good one, and a lot of time we can save. In local anesthesia, the penile block anesthesia, we can use, and we have different sizes. Not that. You hold it. We have different sizes, depend on the size of the penile size. We can assess which number fits for the individual, and we can use this. And we have to open here and fix this anvil, which covers the glans. On it you have to tie with the tire will be there, and after that you have to hold it, tie, fix it, and hold it for 2 minutes, and you will get a nice suturing. Sometimes prepusal skin, sometimes it bleeds, so we have to coagulate, or we have to do an preputioplastic small stitch. That will help, and it is very good and comfortable, and within few minutes we can discharge the patient. That's
Thank you, sir. Thank you, Dr. Saab. Thank you very much for your feedback about CIRCUMSURE. Thank you.